name is Francisco Cidro. I'm a naturopathic doctor with a master's and PhD in neuroscience and a postdoctorate in health sciences. Recently, we have conducted a study looking at the effects of the Vago Vibe device on heart rate variability and overall well-being. We did a pre and post intervention assessment with a single use of the device for 1 hour. And the participants were assessed with a high-tech Italian technology called the PPG performance, designed by Biotechna, and completed self-assessment questionnaires at baseline and post-intervention. So the results that we got was, well, first of all, a significant decrease in heart rate. And that's very interesting because that shows that people were more relaxed after the session. And that was statistically significant result. We also saw a overall increase of heart rate variability, specifically SDNN, which is a very important marker. It's the same one that is measured by the Oura Ring, the Apple Watch, and the one that people are familiar with. It's a measure of overall heart rate variability that reflects the autonomic nervous system balance and also cardiovascular adaptability, how your body reacts to the situations. This is a direct measurement of that. It's very important because the autonomic nervous system is the first, let's say, interface with the environment that you have. So if your body is able to adapt to the situations that are happening, overall you have better reaction, better recovery, better reactivity to the things that are happening. And that's really important. In sports, SDNN is very much appreciated by the athletes because it tells them if they have maybe exerted themselves too much, then the SDNN lowers. And if they need to recover more, they have a lower SDNN. So when the number gets high again, then it's better for them to go back and re-engage in the activity. So the interesting thing is that this device is very easy to use, very small. It's just a pen, and you put it around your neck, press play, and you're doing your therapy. It results in the effects on the autonomic nervous system. We also observed statistically significant effects on relaxation levels of the patients. They felt much more relaxed. And also they had increased sense of well-being, which is, of course, extremely important. Emotional state increased, and we also saw a statistically significant decrease in the levels of anxiety and stress. So combined, the results showed statistically significant improvements in both physiological aspects, including heart rate variability, of course, which is an objective analysis, and also subjective or emotional domains. And there's no adverse effects reported.